Hello. Today we're going to be talking about, does your bite affect your facial structure? Yes, it does. And please stay to find out about how your bite can affect your facial structure. I'll be sharing some knowledge with you regarding your bite. So please stay till the end. Please stay till the end. Very important to share. This is a disclaimer. So this is generally for informational purposes. So this is very important that you read about this disclaimer, and very important that you stay till the end, because we're going to be sharing important knowledge on how your bite can affect your facial structure. So what is a normal bite? A bite is how your top teeth closes over your lower teeth. In an ideal world, your bite should close nicely onto your lower teeth. The top teeth should fall over by 1 to 2 millimeters, and then between the 1 to 2 millimeters. And also, another tip is that the central line, that is the central line between the incisors and the lower, should be the same straight line. So that is coincidental. And the face is divided. You have the top third, middle third. The lower third is your aesthetic zones, and it's very important. So if you have no teeth in this area, your face falls in and your face becomes short. If you suffer from anterior open bites, some people cannot close properly and they have a gap between their teeth. It gives you that sort of long face. And also, if your bite is to the side, it affects your symmetry. So all those are very important. If someone has no teeth or has taken their denture out, the lower third of their face, which is the aesthetic zone, their face falls in and gives them this shortened look and gives them this old age appearance. But immediately they wear the dentures, it gives them a youthful appearance. That is why it is important to hold onto your teeth, because when you lose your teeth, your gums and your bones resorbs and your face falls in. That is why it is not good to go to the dentist and say, take all my teeth out and just fit me with a denture. The psychological impact of losing your teeth. I've seen people shed tears over losing their teeth because they are not prepared for it. Losing that teeth. It is best to lose your teeth gradually. It is best to start wearing a denture and get used to it, because wearing a denture is like a skill. And as you can see in the picture, some people do not smile because they've worn down their front teeth and their lower face has fallen in and their whole face has become shortened as a result. So what is affecting your smile? Some people never smile in pictures. It could be they've lost their tooth. So if you've lost a front tooth, you'll be very self-conscious. You always see them have a frown on their face, but it could be they have problems with their teeth. As you can see in this picture, the lady has got a beautiful smile, but immediately she loses one of her teeth, it changes her smile and changes her facial structure, because she may be not smiling, maybe pursing her lips or frowning. So it changes her facial structure. So it is very important. Your teeth are very important. When they are there, they make you smile, they make you happy, they give you confidence, they help with your chewing. So this is very important. So as you can see in this picture, we have the normal bite. So I'm going to talk about the different types of bites in very simple language. So a normal bite, the teeth closes gently over the lower, and you can see that the center lines are coincidental. That is, it's in a straight line, and everything closes nicely, like you can see in the first picture. The first picture is a steady model. You know, at times you go to the dentist takes an impression of your upper and lower jaw to make models, to be able to make a denture for you, or to look at how your bite is. So that is a steady model. That is showing us about your bite. Now, if you look at an abnormal bite, the second picture has got a gap between the top and the lower teeth. So we have different types of bites. I'll keep it simple. The first one, an abnormal bite is called, another name for an abnormal bite is malocclusion. malocclusion. A bite is how your top jaw relates to your lower jaw, and a normal one is just called a normal bite or a normal occlusion, and is given a number called class 1 occlusion. But if you have a malocclusion, it's called a class 2. A class 2 is, I'm keeping it simple, is when your top jaw is over your lower jaw, and then you have a huge overbite and an increased overjet. The overjet means that the distance from the top teeth and the lower is a little long. Some people's own is about 5 or more. So when you look at their side profile, that is how your facial structure is affected. You notice that their top teeth is much over their bottom teeth. So that I'm keeping it simple. Now, what is a class 3 open bite? A class 3 open bite, you see that their lower jaw is bigger than their top jaw. So they normally bite like this. They bite their top teeth in front of their lower teeth like this. So again, this affects their facial structure. So you see that their lower jaw is larger than their top teeth, and they don't bite over, they bite under like that. Under, and their facial structure is affected. Now, another bite that is also common is open bite. An open bite is when the top teeth and the lower teeth never meet. It can happen posteriorly or anteriorly. When it happens anteriorly, you can see the person doesn't bite properly, and it's always like this. And there are times it could be due to the formation of your jaw, or in other cases, it could be due to habit. Some people suck their thumbs, and when you suck your thumb, it affects your teeth, and it can lead to an anterior open bite. Thank you for staying till the end. Very much appreciated. And please subscribe for updates. See you in the next video. Thank you.